Good afternoon, everyone. My name is Janelle Taphorn. I'm the marketing coordinator here at the Lighthouse of Houston, and I want to welcome you to our monthly online workshop, From Backyard to Bayou, Mosquito Control Across Harris County. We're going to talk about everything bugs today, mosquitoes. I'm new to Houston, and I want to learn what I'm in for. So before we begin, though, I want to start by sharing a little bit more about who we are at the Lighthouse. We've been here for more than 85 years. We've been supporting individuals who are blind or low vision through our health services, assistive technology resources, support programs, vocational skills training, and internal employment opportunities. We serve more than 14,000 individuals, can you believe that, every year through our programs, our services, and our events. Our goal is to foster communities of belonging with accessible resources that support personal and family well-being, learning, development, and employment. We're also proud that more than 60% of our employees are individuals who are blind or low vision. Our mission is to enable and empower people who are blind or low vision to realize their potential. And our vision is a life without limits for people who are blind or have low vision. And we're so excited to share this important conversation with all of you. It's not really directed towards vision so much, but it's something that we can all benefit from at home today. Our topic is timely. It's summertime and there's mosquitoes everywhere. As many of you heard, Harris County is currently experiencing a concerning increase in mosquito activity. And with summer here, we know that it's critical to stay protected and informed. So we're honored to welcome our guest today. It is Charisse Ramatar. She's the Health Education Supervisor from the Mosquito and Vector Control Division at the Harris County Public Health. So welcome, Charisse. Hello.
Hello, good afternoon. Thank you for having me. Thank you so much for having us here today and inviting us to the Lighthouse to give this presentation. We're excited and very, very thankful that we can get some education out there regarding our mosquitoes and other bugs.
Oh, great. Other bugs. Yeah. So as I said, I'm new to Houston. I've only been here 3 months. And I haven't seen a lot of bugs. So you must be doing a great job.
Well, get ready. Because with the combination of this heat and the rain that we're supposed to have this week, we'll have a blossoming of many bugs for you, especially mosquitoes.
Oh, lovely. Well, tell me more. I'm going to turn the stage over to you now.
Okay, great. Thank you so much. All right, guys, like I said, thank you so much for having me here today. Again, my name is Charisse Ramatar. I'm with Harris County Public Health, Mosquito and Vector Control. And we're here today to talk to you about some prevention techniques, mosquito control and prevention techniques here in the South, and especially here in Houston, but as well as give you some information about what we do here at Harris County Public Health, particularly our Mosquito and Vector Control Division. And the title of the presentation today is that we're more than just a spray truck, because I think that's a little bit of a misnomer. People think that our mosquito control districts really just spray for mosquitoes, and that's pretty much all we do. But today we're going to learn a little bit about why that's not true. So Harris County is the third largest county in Texas. So we break this county down into 268 operational areas. So you can see Harris County is large, and mosquito and vector control, we cover every inch of Harris County, incorporated and unincorporated Harris County. So by these numbers. The way we do that is we go through the county and we'll go through this a little bit later. We trap and bring in mosquitoes from every county, every one of those sections in Harris County, and we test them every day. And we know by the end of the day whether they're carrying viruses. And then in response to those viruses or the diseases, it triggers us to do some prevention techniques. But we'll talk more about that later. Right now, we want to give you some prevention tips on how you can prevent yourself from being bit by mosquitoes. Mosquitoes can be very dangerous. They carry mosquito-borne diseases. Then when they bite you, can perpetuate those diseases and transfer those diseases to you and make you very ill. So we're here today to try to get you to understand how important it is for you to protect yourselves from mosquito bites. And here's a couple of ways that you can do that. Number one way you can do that is by using an EPA registered insect repellent. That's the Environmental Protection Agency has registered certain products and certain ingredients in repellents that make them active against as insect repellents. And we'll talk a little bit about that on the next slide. Number two is we want you to wear long clothing, long sleeves, long pants, socks, cover the skin while outdoors. I know it's hot in Houston and everybody's like, oh, it's so hot, but they do make long sleeve clothing that are light in color, light in texture and fabric. That does, like you see the ones that people use when they're going fishing or at the beach, those things to help cover the skin and protect it from mosquito bites. Number three is we want you to keep your yard waste, your yard clean. We want to keep all yard waste from blocking any drains or causing any areas of pooling water around your home. Mosquitoes in their infancy stage, in larvae and eggs, they live in water. And so without any water around your home, we can't breed mosquitoes, but there's lots of little nooks and crannies around the yard, especially when it rains like it's going to do this week, where mosquitoes can breed. And so we want to watch out for those and eliminate those areas. Number four goes along with that. We want to empty and remove all items that hold water in and around your home. So if there are any areas of water around your home that will hold water after a rain, say for anywhere from 4 to 7 days, you're going to want to try to get rid of those areas at all costs. You're going to want to dump those areas of water out, remove those items, poke holes in them, anything that you can do so that the water is not standing or stagnant. Number five is going to be, we want you to install or repair your current window screens or doors on your home so that if you open your windows or your doors to get some fresh air, probably not so much right now because it's so warm, but when the weather is nicer, if you do that, we want to make sure that the screens and the screen doors are all in good functioning repair, no holes, no tears where those mosquitoes can get in. The last thing we want you to do is also to protect your pets from mosquito bites as well. Pets are susceptible to mosquito-borne diseases as well as heartworm and some other things that are carried by mosquitoes. So it's important that we protect them as well. One of the ways you can do that is you can minimize walking your pet from dusk to dawn hours. So in the evening times, you want to walk them in the day when the sun is up. There are also insect repellents for pets that you may use, and we advocate that you talk to your veterinarian for suggestions on what insect repellents for your pets would be best. Like I said, we're going to talk a little bit about insect repellent because they're not all created equal. We talked about using an EPA registered insect repellent. So that means that an insect repellent that has been certified by the Environmental Protection Agency to contain a product or an ingredient that is an active insect repellent. So on the screen here, you can see that there are 5 active ingredients that the Environmental Protection Agency certifies as active ingredients in order for insect repellent to be a certified and effective insect repellent. The number one ingredient you see on there is DEET, and that's probably the most common one you see in the chemical form. Deep Woods Off, all of those ingredients, they have DEET in them. Here in Harris County, we recommend at least a percentage of 20% or more concentration of DEET in your insect repellent. The concentration of DEET doesn't necessarily mean that it's stronger or more potent. It actually refers to how long that product will last when it's applied to the skin. So at 20 to 30% in potency of DEET in the active ingredient means that that product will last on the skin probably about 4 to 5 hours before you have to reapply it. Now there's IR35. 35 is another chemical ingredient that is out there. You find that usually in the family cares, the unscented brands, so forth. They tend to use the IR35. 35. Picaridin, oil of lemon, eucalyptus, and 2-undequinone are all natural products. Picaridin is probably the one you see most often in Avon Skin So Soft. Oil of lemon, eucalyptus you can find on the shelf. It's a yellow oil. Those are all natural ingredients versus DEET and IR35. 35 are chemicals. And then if you'll read the card a little bit more, we do not recommend using any of the DEET or IR35, any of the chemical agents on children less than 2 months of age. So babies that are under 2 months of age, you want to just cover them up and keep their carrier covered, long sleeves, long pants. They are safe for children over the age of 2 months old. Our all-natural products, picaridin, oil of lemon, eucalyptus, and the 2-undecanone. If you read on here, the EPA does not certify for those to be used on children 3 years or younger. And that's because there just hasn't been as many studies done on the all-natural products. So it's probably a little bit opposite of what you think. People think, oh, the all-natural products should be good for my kids, and actually the studies aren't there yet for the all-natural products. But if you do have skin sensitivities to the DEET or the IR35, you can try one of the all-natural products. So one of the myths with repellent is that we spray it on and we just kind of let it air dry in the places that the spray touched. That's not quite the most effective way to wear repellent. When you spray your repellent on, you want to spray it on and you want to rub it in, sort of similar to lotion. You want to get that repellent to cover all areas of your skin. If we don't get it to cover all areas of the skin, any exposed areas are where the mosquitoes would be susceptible to biting you. If you're going to be wearing any sunscreen or makeup or any other product similar to that, you're going to want to apply those first and then apply your repellent over that. The repellent should be the last layer. All right, and we have a little moniker that we try to help people remember how to protect themselves in and around their home from mosquitoes, and it's called the 3 T's. It's called tip, toss, and take action. And the first T is tip, which means we've asked that you tip out or throw away all standing water out of any containers or areas around your home after rain or anywhere you see standing water that's there for a couple of days. You want to toss that water out. The second one is toss, which throw away any litter, debris, or yard waste that could be blocking storm drains, that could cause areas of stagnant water, such as old tires, any type of trash or debris, any tree waste, trees, the old rotten trees, they hold water, and the mosquitoes love to breed in those. And then the last one is take action. We want you to wear like we discussed, your insect repellent, wear protective clothing, limit your activity outside between dusk and dawn. And we want you to kind of keep a tidy yard so that there's no areas that limit the amount of areas that can breed mosquitoes. Now we're going to get a little bit more into what mosquito and vector control does here at Harris County. We are more than just a spray truck, like I said. We have several sections. We have about 9 sections within mosquito and vector control, and we work all together in a group, and we work in an integrated pest management system in order to find mosquitoes, locate mosquitoes, test them for viruses, and then provide treatments to treat them, and as well as educate the public on the ways that they can keep themselves safe. So you can see all the sections here, and we'll kind of go through them a little bit one by one. Our first section is our mosquito surveillance section. Like I said, they are the ones that go out there to all 268 of those areas that we saw at the beginning on the map, where we set traps, we retrieve those traps, and we bring those mosquitoes back to our labs every day, and we test them. They cover all of those 268 areas in Harris County within 1 week. So we're trapping all our areas weekly within Harris County. Right now, we're in our period of high disease risk transmission, which is May to October. So people will say, oh, it's mosquito season. Well, here in the South, especially in Texas and in Houston, mosquito season is year round. There is no reprieve on mosquito season. They are here all year round. But we do have times of the year where there are high disease risk transmission, and as well as medium and low disease risk transmission periods. So right now we're in high disease risk transmission. And so we ask that you be very vigilant during this time. It's when it's going to get hotter. Like we said, this week, we're going to have more rain, and those mosquitoes are going to love that water. And we're going to have a flourishing of mosquitoes here with this perfect environmental conditions. Our next section is our avian or bird surveillance. We actually also do surveillance on birds in our county. In all those areas of Harris County, we collect birds on a daily basis. Our avian biologists are out every day trapping and netting birds. We're catching them, and once we catch a bird, we're banding the bird so that if we catch this bird again in the future, we know when and where it's been caught. We can tell whether or not it had disease prior. It doesn't have it now. So it's a way of tracking birds, but we also draw blood from those birds, and we're able to test the birds to see if they're carrying any of these viruses that we commonly are carried by mosquitoes. We do this because birds are the reservoir of disease. A mosquito bites an infected bird, it becomes affected, and then the mosquito bites you and then passes that infection on to you. So our birds are our early warning signs of disease in our community. MVCD, mosquito and vector control, we also collect dead birds from the public. So if you come by a dead bird in and around your home and the bird is still in relatively good condition, you could give us a call and we would be able to come out and pick up that bird. And if it's in good condition, we would be able to test it and see what it died from, maybe the reason why it died, and do some more monitoring that way. So that's something that you can contact us for as well. We have a third surveillance section called the vector surveillance section. A vector is anything that can carry diseases. So mosquitoes are vectors, but there are lots of other insects and bugs in our repertoire here in Houston that do carry diseases. One of the common ones that we're looking at right now is ticks. We all know, may or may not be familiar, that ticks carry diseases such as Lyme disease, Rocky Mountain spotted fever. And if you go hiking or in the bushes around your home or a dog park, or your dogs are out in the brush, they can pick up ticks. So ticks can also carry diseases when they bite you. So we also monitor for ticks. We have a team that goes out and collects ticks daily, and we run tests here on them as well to see if they're carrying any viruses. Another service we offer the public is that we will accept intact ticks from the general public. So if you are out with your dog at the dog park, or you're on a trail running and your dog happens to pick up a tick, or you find one on your clothing or on you, if that tick is intact and you can remove it intact and give us a call, we will have you bring it by to us and we can test those as well. So this is our virology lab. This is where all of our mosquitoes and ticks are brought into us daily, and they're sent to this lab. This lab performs all the functions, and we test our mosquitoes every day. And by the end of the day, usually early afternoon, we're able to tell whether or not those mosquitoes were carrying any of these mosquito-borne diseases, such as West Nile virus, dengue virus, Zika, chikungunya, St. Louis encephalitis, and such. So we are the only program in Texas that performs all of our operations in-house in that integrated pest management system. So we have our own virology and testing labs here on site. We also have our testing and evaluation and our research divisions. These are in-house divisions that help us understand if what we're doing to treat mosquitoes and other vectors is working. Our testing and evaluation section does that by monitoring the types of pesticides we use to make sure there's no pesticide resistance and that the products that we're using are active. Our AMCAR division is our research division, and they we partner with other private companies, universities, and to test new protocols on ways that we can control mosquitoes. And one of the techniques that they are currently working on is the sterile insect technique. And that's kind of interesting in the fact that instead of spraying and killing mosquitoes or treating mosquito eggs to kill them, they've devised a way to test this technique where we raise mosquitoes here in our insectaries on site. And we take those mosquitoes and they place them in a radiation machine, and they radiate those mosquitoes, male mosquitoes, until they're sterile. And then we can re-release those sterile males back into their environment where they compete with normal males to mate with females. And if they do mate with females, when the females lay those eggs will never hatch. So kind of ways to attack reducing the mosquito population from different angles. We also have an inspections department. We have several inspections on site here at MVCD where inspectors can come to your home and do a survey in and around your home to see if there are any potential breeding habitats around your home. They can also assist you with treating those areas or assist you with letting you know how to eliminate those areas. And that's something that we offer the public here year round. And you can call 311 for more information or contact our offices. Now, once we find mosquitoes that are positive for disease in any area around Harris County, that then triggers us to start what we call adulticiding, which is the spraying that kills mosquitoes. So we respond to spraying. We use our spray trucks in response to disease. So we will only spray, Harris County Public Health will only spray if in response to disease. Once we find a diseased mosquito, bird, or human in an area, that triggers us to spray in that area and surrounding areas. So that's a big question we get about people asking, well, why don't I see the spray trucks around my house? How come you don't spray as much as you used to? Well, Harris County Public Health does not spray for what we call nuisance, which just means that there's a lot of mosquitoes in and around. We spray in response to disease. We're tasked with trying to prevent and limit disease. So that's when you will see our spray truck. So if you see a spray truck that is a Harris County Public Health spray truck, they are there in response to us finding some sort of mosquito-borne illness in your area. In times when we have disasters such as hurricanes or flooding or severe weather, in extreme cases, we also can institute aerial themselves. So we're here for a link between mosquito and vector control and you. So again, I wanted to say that we at Harris County Public Health is more than just a spray truck. We do a lot more to help improve the public's health, but we do need your help. Like I said, you are a big key component of prevention in how you protect yourselves and your family members, and what you can do in and around your homes to protect yourselves and your family members. So, well, like I said, we need you. We want to call you to action. We want you to perform those 3 T's that we talked about, which is tip, toss, and take action. And I apologize for that slide. It really shouldn't look like that. But it is tip, toss, and take action. So we want you to throw away all of that water that you have around your house, toss away any debris that you may be holding that you can get rid of that would hold water. And then we also want you to take action. Wear your insect repellent and EPA registered insect repellent, long sleeves and long pants, minimize your time outdoors between dusk and dawn, and protect yourself and your family members. So that's all I have, and I'm going to open up the floor for questions and see what we have.
That was awesome. I learned like so much. Thank you so much, Cherise, especially about the bird banding. I had no idea that that was even a thing. So
yeah.
One question that came up in my head when you were talking about DEET and how it's not recommended for babies and kids under 2. What about for pets? Like I have a dog, so how would is there any way to protect
so
pets?
There is ways to protect the pets, and they do have specific pet insect repellents that would be specific to pets. You would find those at the pet store, or you can talk to your vet about those. They're a little bit different to the insect repellents that we use. They're more along the lines for things that they use for preventing heartworm and so forth. Different. Great. So yes, it's not advocated that you take your DEET for yourself and spray it on your dog.
That's what I was thinking.
No, not to do that. We have recommended that people can take the insect repellent and spray it onto the pet's collar, to help, but not directly on your dog. They have products that are made directly for them, and you can talk to your vet about that.
Great. Another question that came up was, for standing water, like in your plants, indoors or outdoors, is there some sort of, I think I've seen them, they're like a cake or something that you can stick inside?
That's correct.
Are those effective?
That's correct. So we advocate, of course, any water that's standing that to throw it out. So if you're watering your plants to where there's water actively sitting on top of your plants, you're probably overwatering them. But if you've got a plate underneath underneath the plant pot that collects water, you can put holes in the plate. But if you can't do that, there are products. They are called mosquito dunks or mosquito chunks, and you can buy them at Home Depot or online at Amazon. And those products are they almost a crumbly porous solution that all the instructions will be on the back. You can add it to that water and it would dissolve, and that water, it would be active in that water for 30 days. So if mosquitoes do lay their eggs in that water, and once those eggs hatch into the larva, which are those little wiggly worms that you see in water, they will eat that product and then will die. So, and you can apply that to the water and just follow the directions on the back of the product.
Okay, perfect. The other thing that just came to mind is mosquitoes generally, don't they come out more at night, or the increase seems to increase more at night or
Different
does.
species. No, listen. So there's we have 56 different species in Harris County. So different species feed at different times. The most predominant species that we have here in Harris County tends to like to come out at night. We have other species that will come out in the day and feed during the day. So that's the reason why we see more of a preponderance of mosquitoes in the evening time based on the species that we have here. And so the myth is that you can't, mosquitoes aren't around during the day, but they are.
Okay.
We just see more of a preponderance of them in the evening time because of the type of mosquito we have most predominantly here in Harris County.
Okay. Well, I'm trying not to itch, like talking about this.
Well, it would be a natural reaction. Trust me, that's what everybody says. I was like, no, I feel kind of itchy. But if it reminds you to wear your repellent and cover that skin, then I think we've done our job.
I think that's right. And I also love that you put a QR code up. So as we're wrapping up here, I want to thank you so much, Charisse, for joining us today and giving us really helpful information now that it's high disease risk season right now, right?
That's correct. It started high disease risk transmission season in May, the end of May. And I do want to let you know that we have found our first cases of West Nile virus in mosquitoes in certain areas of Harris County in this last week and so it's here. We want you to know that, we do have mosquitoes that are carrying disease, and we want you to make sure that you protect yourself and your family as much as you can.
Awesome. That's right. That's what we're all about, is empowering individuals and families. So we appreciate your partnership of the Harris County Public Health and the work that you and your team does. That's so great.
Thank you for having us. And if anybody has any more questions, the QR code will take you to our website. If you have anything you want to report a dead bird or a tick or anything like that, you can do that all through our website.
Great. And the website is at the bottom there, www.hcphtx.org/MC. And for those of you watching, you can find additional resources for blind and low vision at our website, which is www.houstonlighthouse.org. So thank you, everybody, for joining us. Stay safe and bug-free this summer.
Yes.
Bye for now.